Hello there, my name is Sandra Smith. I'm a TAP lead at Barnet Castle. I work with the district nurses and I work for County Durham and Darlington NHS Foundation Trust. Because we're in quite a rural location, the nurses have to travel out to patient homes. The bonus of having the wound care app is they can take a photograph whilst they're at the patient. The health call application uploads it straight onto the electronic patient record, so straight onto System 1. The benefit is the nurse can remain with the patient, and because the upload is so rapid, we can actually be in the office and view the wound as the nurse is viewing the wound in real time. So we can give that nurse advice around whether we think the wound is deteriorated, whether we think the wound is improving, whether there needs to be a change of dressing. It's particularly useful for the more inexperienced nurse who needs that senior review of the wound. We found that absolutely beneficial for our patients. Prior to having this wound care app, there was no facility to take any photos of wounds at all. Benefit of this is it's not stored on the device, so the wound is stored within the app rather than being stored on the device. And it's linked directly to the patient, so it's covered by all governance. If somebody wanted to show me a wound previously, they would take a photograph, upload it to a desktop on their computer, attach that to an email, and then email that to me when I can open the image, look at the image, and then give them some advice. And obviously that's a very lengthy process. With this wound care app on the smartphones, it's instantaneous. The wound picture is there, and it's directly linked to the patient, so is covered by governance. The image itself is excellent. At the beginning, it was a little bit round to user error. Maybe they were too close to the wound or too far away from the wound, but the camera facility on the phone allows you to sort of judge that, and once you've got it into focus, it takes the picture. It's point and shoot basically. The wound pictures are really good. If you use a marker that you get in the dressing pack, which gives you a measurement, and you place that measurement almost in the same place all the time when you're taking photographs, you can see improvement or deterioration in the wound because you can see by the sizes. I think patients probably have thought we always did have this facility and never maybe realised we hadn't. Patients who have chronic wounds, what we find is they take pictures of their own wounds because they like to see a difference. And I've certainly had patients where if the wound's been somewhere where they can't see themselves, they've asked me to use their phone to take a picture of the image because they need to see what's going on. Obviously this is a much safer and more secure way of doing it, and I think the patient is reassured that actually there's some continuity there because we're looking at a wound again and again and again in the same way. But there's the opportunity the patient then has is that other specialisms can see the wound. So a tissue viability specialist can see the wound, a dermatologist can see the wound, GPs can see wounds because it's all shared on System 1. So every specialist can see it without that wound the patient having to take that wound as such into a clinic for the wound to be exposed, to be covered up again. If you said you were going to take this away from the team, you would have a fight on your hands. The team absolutely love the fact that they can take pictures, they can share that learning. COVID has led us to we're not in the office together as much, so that ad hoc learning doesn't actually happen, that informal clinical supervision doesn't happen, or it can be lacking if you don't make it happen. With the wound pictures, it's a talking point and it's a teaching point, and certainly from my own point of view, I'm a teacher at heart, is that I can sit and say to people, this is what slough looks like, this is what necrosis looks like, this is what healing looks like, this is, it's there in front of them, and they understand so much more because they've got a visual image in front of them. But you would absolutely have a fight on your hands if you were going to take it off us. What we found was once we got over the initial sort of the newness of the app, we decided that we needed a structured approach on when photographs were going to be taken. Initially, we asked the team to take photographs lots and lots of times. Every time they went out, if they had an opportunity to take a photograph, to do that, because we wanted to test the demand and capacity of the app. Because there was only 3 pilot areas, what we didn't want was when the rest of the areas came on board, that the app then collapsed, which it hasn't done. What we've decided is there's certain times that we would like photographs to be taken. So we're doing it as part of initial assessment. Patient comes to the team through any referral route. If they've got a wound or a skin condition, we can take a photograph. So we've got a baseline and absolute starting point. We then look at any commencement or changes in treatment. So the minute you think about changing a treatment or starting a new treatment, then we would take a photograph as well. And what we've said we need to be smarter on is taking a photograph at the end of treatment, so we can actually see maybe it's a wound healed, or a wound healed to the point of where that patient is then being discharged from our team and going into a different service, or if they're moving location. So you've got the full journey of the wound whilst they're in our care. What we found this would be valuable with is any incident reporting, because we report incidents of skin damage when the patient comes to us, or when the patient goes to another area, they would report it. It's nice to have an actual picture of what it was like whilst it was in your care. When it goes to another area, what was it like in their care? So if they come back and say this patient has a really awful wound, it's bleeding or whatever, we can say, well, actually this is the photograph as they left us. So I think that's going to be a really valuable thing, but it's something we need to get better on, because it's very difficult to remind people to take photographs of a healed wound. Well, it's 2:30 on a Monday and I've seen 5 photographs this morning. I would say my team are now using it very, very regularly, at least once a day, possibly up to 5 or 6 times a day, depending on the patients that they see. We use it for reviews as well, so we will set a care plan to take a wound in a week's time. So you don't have to go and visit the patient. It doesn't have to be me that visits the patient. I can just ask for a photograph and have a look at it. What we've had is a dermatologist very, very recently start a patient on some treatment and has asked for a photograph in 4 weeks' time. So we've set a care plan. Now our HCA, our healthcare assistant, can go in there and take that photograph, and then the dermatologist can see that photograph and then make a decision on treatment, whether to discontinue treatment or whether to continue treatment. I think the GPs are finding it advantageous that they can actually review skin conditions if we're considering things like antibiotic therapy. And I think the GPs have actually expressed a massive appreciation of how very complicated and complex wounds are in the community that they haven't seen before. They sometimes don't realise what we are actually dressing when we're out there. The only way they can have that any appreciation is by doing a joint visit. Obviously during coronavirus we tried to reduce footfall, and this has absolutely been at the right time to do that. And I think this is something we need to continue, because we can continue to reduce this footfall, protect our vulnerable patients. We can go in and the GP can see the photograph at the same time. So joint visits with tissue viability specialists doesn't have to be a joint visit where there's 2 physical people standing next to each other. You can have it like true telemedicine, really. Somebody in an office and somebody stood with the patient.